Skincare, and joining us from Living Well Aesthetics, we have Dr. Jared Chapman. Thanks for taking time to talk with us.
And thank you for having me, Susan.
Yeah, today we're talking about Daxxify. What is this?
So Daxxify is one of the newest neurotoxins to hit the market. Is the first innovation in neurotoxins in over 30 years. So basically its advantage, just straight to the point, is it lasts long. Lasts about 6 months. So it covers the same treatment areas that the other neurotoxins cover, which is the forehead and the lines around the eyes. But it has the advantage of lasting up to 6 months in most patients, and about 19 to 20% of the patients could see results up to 9 months. So it's about longevity with neurotoxin.
Mm-hmm. How do you apply it, and what makes it different from other products that also claim to smooth out our wrinkles?
Yeah, so it's injected the same way as all the other neurotoxins. We use a very small, I like to say very small needle to inject into the muscles in the forehead and and what we call the lateral canthal or the crow's feet area. Takes about less than 2 minutes to do the procedure. The neat thing about this is the innovation is that there are no human products in this in neurotoxin. In other neurotoxins, we have albumin as a transport molecule. In this particular neurotoxin, we use a positively charged lysine backbone, which is an amino acid that occurs naturally in our system. This positively charged molecule helps carry the toxin to the neuron and allows it to get more of the toxin inside the neuron to do its job. Therefore, you have a higher level of the toxin that gets in, and then we believe that's what gives its longevity in the treatment of the patient. It also has a faster onset of action. In myself, it was within 24 hours that the neurotoxin had taken effect. Most neurotoxins on the market take 5 to 7 days to achieve their results. But with this particular toxin, we are seeing a faster onset of action. And I'm also seeing probably a higher level of relaxation with this neurotoxin. So I'm seeing a tighter look with this particular treatment. And so, again, the advantage is that there's fewer treatments per year because in most patients, again, this lasts up to 6 months. And then the other advantage is if you need something that has a faster onset of action, and some people like that tighter look, that tighter freeze, we call it, then this would be the product for you. There's still, you need to meet with your injector, with your provider, and discuss, the things that you're looking for in a neurotoxin. And, again, Daxxify I don't think is for everyone. I definitely don't think it's for someone who's never done neurotoxin before, because I would want to use one of the others that would obviously not last as long when I'm first, introducing a patient to neurotoxin. And Botox is still my other neurotoxin of choice, and I think it does a great job as well. It's the longevity of Daxxify is what we're looking at, and this innovation in the molecule is quite, I think, unique, and we're very excited to have it here at Living Well. We're the only office that carries Daxxify at this point in the state of West Virginia, and we'll be the only one where you can get it through March. So it's a big, a big honor to be able to present this to the people of West Virginia.
Okay, so and if someone wants to come in for a consultation and find out if this is right for them, or maybe there's something else that might work better, what's the best way for them to contact you?
We have a practice cell phone, which is great, 304-989-2065. They can text that number or call that number. And of course, we have 2 locations, one in Milton and one in Charleston, conveniently located with great parking, and it's easy to come in. Again, like you said, consultations are free. So it's good to come in and just talk about these things if you're interested in them and find out what's right for you as the patient. So, and that's what we're always looking for. This is just a great advancement in neurotoxins, and it's a great thing to have in our repertoire of things to treat the forehead and the lines around the eyes.
All right. Well, Dr. Chapman, thanks for sharing this with us today on Studio 3.
Yeah, thank you for having me.